Thank you, Carol. Could we hear from Dr. Crowley, James Crowley?
Well, glad to be here. I've been here for several times in the past, and I basically have the same message, but I want to make sure that I get a chance to emphasize it once again. My name is James Crowley. I'm an MD. I live in East Providence, and I'm a member and former president of the Rhode Island Medical Society and a professor emeritus of medicine at Brown University. We've heard so much tonight, and a lot of what I'm going to say is just going to reiterate it, but I just want you to know it's my real feeling, though. I'm not reiterating. Virtually every scientific study has found marijuana or cannabis to be less harmful than alcohol or tobacco. So whatever is said about it, it is less harmful than alcohol or tobacco. There is no known level of marijuana reachable in the human body that can cause an overdose death. So we've again heard tonight, overdose, marijuana overdose, and then is it marijuana? There is no known level of marijuana that can cause an overdose death. No one has ever died of an overdose death from marijuana. So any suggestion to the contrary is erroneous. Punishing those who choose to use cannabis, which is a safer substance than alcohol or tobacco, because it relaxes them. I would tell people as a doctor, look, you want to relax, go to the gym, exercise, walk, do things with your family. But do all people do that? No, a lot of people turn to substances, because it's kind of a quick way to relax. A lot of people will do that. But in allowing people to have these dangerous substances, alcohol and tobacco, and denying them a safe substance, cannabis, that doesn't make sense to me. It never has made any sense to me at all. And finally, in the very selective law enforcement, I was here earlier when the police chief testified, and all I could see was the inner city, what Jim Davis said. This oppression of youth there, of young men, marking them for life, can't get a job, can't get loans to go to school, and so forth. But anyway, that's all important, extremely to me important, but it's not why I'm here. I'm a physician, and I'm here to argue for the public health issues that involve legalizing marijuana. What are the benefits in terms of the public health issues? Well, first, consumers today who are consuming marijuana are buying it in the illicit market, which means that there's absolutely no guarantee of what they're actually taking. They could be taking anything. They could be taking any type of substance that's been mixed with something else, and so on and so forth. And while there have been no deaths from marijuana per se, there have been deaths from marijuana laced with substances as bizarre as formaldehyde. And so I think one of the big benefits that we're going to have is we're going to have a pure substance, like a real drug, one that has a certain concentration in it that one can say, oh, that's strong, or no, that's weak. I want the weak one. I want the strong one, whatever. Now you get whatever they give you. And whether your body is prepared to take the strong one isn't really clear. And a person who purchases today on an adult who purchases on the illegal market takes the chance of taking in something that perhaps in a previous form that he had purchased was harmless to him, just simply relaxing that man or woman, and now is causing that person to be out of control for operating an automobile. So I think, one of the big benefits of legalization will be standardization of dose and purity. The second important public health benefit is that currently marijuana is erroneously classified by the federal government as a Schedule I drug, which in the definition of that means that it can kill. It can kill from overdose, one, and two, it has no medical application. Marijuana obviously doesn't fit that category. That's a complete piece of fake news or lie that somehow crept in there in the federal government for reasons that have been explored here earlier, that really are discouraging to think of what was the motivation behind this. So I think I agree with the young man who said that each state should pass laws legalizing marijuana to correct this this misconception and erroneous idea, which has killed research on marijuana. An NIH funded researcher who tries to do research on marijuana will lose his funding. A veteran in the Veterans Hospital who wants to study marijuana in the Veterans Hospital, if it's found out, will lose his job. The federal government is oppressing people who are trying to actually figure out what are the harms and benefits scientifically through research. So the second big benefit will be if the more states adopt it, including Rhode Island being one of the leader states so early in the medical marijuana, now here in legalizing it, this will promote research on harms and benefits and allow for a real fact-based discussion of what's good and what's bad about marijuana. We don't really know. Third, under prohibition, which is so often promoted, I've listened to it tonight, I've heard it so many times before, it's promoted as prohibition is the way to keep it out of the hands of children. Well, this is just a big lie. Children, minors, have complete access to it. It's the only really drug that's sold in schools. The access is the market is saturated. The idea that more than 20% of seniors in high school in Rhode Island are going to want marijuana because it's saturated market. So these arguments that somehow introducing legalizing marijuana for adults will increase the use of minors is ridiculous. And I think that, in fact, prohibition has caused minors to have so much access to it because it's a big market. I believe in the long run, the legalization will choke off that market. People who are in the sales of marijuana will not want to risk losing their licenses. Alcohol used to be sold to teenagers during Prohibition in the 20s and 30s, if you take the time to go back and look at it. And it disappeared by about 5 or 6 or 7 years after the repeal of Prohibition. Teenagers were no longer buying alcohol. It wasn't available. The people that sold alcohol had liquor stores. They wanted to keep their licenses and earn their livings honestly. And I think that's what's going to happen with marijuana. Maybe you could say, well, you're being optimistic. I am being optimistic, but there's a basis for it, which is the fact that this happened with alcohol. Finally, legalization of marijuana has 3 features: regulation, taxation, and legal availability to adults. And here in Rhode Island, not here in Rhode Island, but here nationally in this country, we have about 20,000 here in Rhode Island, we have about 20,000 people who use opioids and cannot afford to get care for themselves. They cannot afford to go into recovery treatments. It's simply just not available to them. That's 20,000. This has been subject of an editorial in the Providence Journal. They struggle with opioid use disorder. These people are treated as criminals, as lowlife, as some kind of scum. They're not. They're just human beings like anybody else, but they have a sickness, an addiction, which is called opioid use disorder, and they need to be on treatment. This law, as it's designed and as it's been crafted so far, will provide the kind of funds that are needed to get these people, these 20,000 people who are at risk for death from drug overdose, into recovery programs. And I think that would be one of the major benefits from a public health point of view. There's some other connections between marijuana and opioid overdose deaths, too, which are interesting to reflect on. An AMA published study showed that states with legalized marijuana have a 25% reduction in opioid overdose deaths. That's a big amount of reduction, and the presumption is that its availability through a legalized and medical marijuana way is a way of a person who's at risk for opioid overdose having some alternative to overdosing and dying via marijuana. Another recent study from Columbia University, 2015, it demonstrated that those who were using marijuana who enrolled in recovery treatment programs were much more likely to finish the program. So it appears that marijuana has a beneficial effect on opioid addiction and as an alternative, and also on completion of treatment for recovery. So in summary, H555 will set the stage, I believe, for eliminating tainted marijuana products and allowing more honest, fact-based discussions about harms and benefits of marijuana. It'll work toward ending the widespread availability of illegal marijuana that's sold to minors, and it will promote better care and outcomes for those who are at risk for opioid overdoses. So thanks for the opportunity to speak to you, and again, go on record that I'm strongly in favor of this legislation. Thank you.
Thank you, Doctor. Any questions?